The natural beauty of the human face has fascinated people for centuries. Artists through the ages have attempted to capture and preserve this beauty. Aging, illness and the elements all leave their traces on the face. Today, the medical profession has unique possibilities to erase some of these changes and restore the unique natural beauty of each face or define facial contours. Currently, there's a growing interest in non-permanent and minimally invasive aesthetic procedures that offer immediate results and short downtimes. Through a combination of the physician's aesthetic sense and expertise in using the latest addition to the Restylane range of instant aesthetic treatments, the face can be contoured, volume can be created, and defects filled. Around the world, more than 1.5 million treatments with Restylane have been carried out in more than 60 countries. Restylane Sub-Q is a new Nasha product from QMed for deep subcutaneous injections in the face. It's used for shaping facial contours such as the cheeks or the chin and combines convenience with predictable results. The larger Nasha gel particles are of a size ideally suited to provide lifting capacity and durable volume. Depending on the treatment site, the depth of injection may vary from the subcutaneous fatty tissue to just above the periosteum. Until now, physicians wishing to use larger volumes to shape and contour the face have mainly relied on autologous fat injections. Restylane Sub-Q represents a completely new approach that allows the physician to achieve predictable results when sculpting or defining the contours of the face.
For me, most of my patients are people in their early to late 40s, have noticed a little bit of loss of and descent of the mid-cheek, mid-face area, and they're not quite ready for a facelift, but they do have some volume loss, and you can see that through the cheek. And those are excellent patients for consideration of Sub-Q. The other good patient are those who are younger, who may want a little more definition of the cheekbone area, who may find that they want a little more of a cheek or a little more definition in the area, and they do very well with the product. The third patient that I think is an excellent candidate are those who otherwise would be wanting a chin implant.
I think the product is going to have two uses. It's going to be useful clinically in patients that have a problem with facial atrophy for whatever reason. There are certain clinical syndromes, of course, that result in loss of facial fat. It's also going to be useful for milder degrees of clinical deformities such as scars.
Restylane Sub-Q is a completely new treatment option for instant aesthetic treatment. With Restylane Sub-Q, the facial contours can be defined, volume can be created, and defects filled. Restylane Sub-Q is easy to use, and it provides instant and predictable results with a short patient downtime.
There's a lot of advantages, I think, of Restylane Sub-Q over fat. One thing is it will have predictability. Fat itself doesn't have predictability. It doesn't seem to last the same in every individual or last the same within an individual depending on the location that it's placed. A tremendous advantage to Restylane Sub-Q is that you will be able to understand its stability and longevity, and that wherever you place it, you should have the same longevity in every location. The next advantage of Sub-Q is that you can place it in less passes than you can with fat. And that will give less pain, less edema, and less swelling for the patients if we can put the Sub-Q in less passes.
Easier to use than fat in the sense that no donor site is required and no harvesting or centrifugation is required of the product. We simply just open another syringe and inject the material.
Treatment with Restylane Sub-Q is an in-office procedure. The area to be treated is cleaned with a suitable antiseptic solution and draped. The majority of patients tolerate the procedure well with local anesthesia. First, a local anesthetic is injected at the planned incision sites. For further anesthesia, a variety of techniques are suitable. Some physicians use regional nerve blocks, whereas others prefer direct local infiltration of the subcutaneous tissue. or a combination of the two techniques. For direct local infiltration, a local anesthetic combined with adrenaline both enhances the anesthetic effect and minimizes the risk of bleeding and bruising. Application of melting ice may also be helpful. The cannula is primed with Restylane Sub-Q. A small droplet of product should be visible at the tip. The cannula is blunt-tipped. As the Nasha gel particles are bulky, it's important not to use a too narrow cannula that could damage the product. A size 16 to 19 gauge cannula is recommended. Once the local anesthetic is taken, a small stab incision is made, for instance in one of the pre-existing crow's feet, using a number 11 blade. The incision is just big enough to fit the cannula. It's important to ensure that the patient's eyes are protected when working in this region, by keeping a finger between the instruments and the eyes. Here the cannula is inserted and tunneled in the deepest layer of the subcutis, just above the periosteum. Patients will both feel and hear the penetration of fibrous tissue as the cannula is introduced and should be informed about this. Restylane Sub-Q should be injected as the cannula is withdrawn. To prevent leakage of the material, injection should be stopped well before the cannula is pulled out from the skin. The product flows easily through the cannula, and it's recommended to deposit the material in several small portions rather than a few larger deposits. Here the physician is injecting the product in a stepwise manner. The depth can be judged by the feel of the cannula through the skin. As the cannula is blunt and wide, there's very little risk of penetrating the skin or infiltrating product intradermally.
The mid-cheek area I found did very well by depositing the material in the deep subcutaneous fat. I found that you did not need to make as many tunnels as you would by injecting fat, and that making maybe 4 or 5 tunnels in a fan-like shape was sometimes enough, depositing small amounts of material in that area.
The projection and curvature of the cheeks are best judged by looking directly down from the patient's forehead. Once both cheeks have been treated, their symmetry is assessed. After injection, the treatment area should be gently massaged to conform to the contours of the surrounding tissues. At this stage, firm pressure should be sufficient to smooth out any unevenness that may have formed. Here we can see the patient before and 3 months after the procedure. Injecting Restylane Sub-Q into the cheeks often creates an effect similar to a mid-facelift. This younger patient has been treated with Restylane Sub-Q to enhance the contours of her cheekbones. After the procedure, patients should be advised not to apply pressure to the injected area and to avoid massaging the area for a few days following the injection. This to avoid a possible risk of product mobility.
Typically following injection, because the needle is passed several times through the tissues in different planes, there's a moderate amount of edema that occurs. Usually bruising is mild. Typically in our experience we've only seen bruising last for about a week.
This patient would like more projection in the chin area. An alternative location for the initial incision is in the submental crease. Again, the cannula is first tunneled deep under the muscle in the subcutis, just above the bone.
As I'm withdrawing here, I'm going to infiltrate a small amount. And on Lisa's case, I want to infiltrate slightly more, slightly lateral to the point of the chin. Otherwise, I'm going to make her chin too pointy, which she doesn't want. And you can go right across the midline. So I'm actually feeling where the tip of the cannula is, right here. You can't feel it though, right, Lisa?
No.
No. And as I withdraw, I'm infiltrating a small amount. And after the deepest layers, which are the most difficult, then I'm starting to come more superficial. Right almost to the subdermal area, But in Lisa's case, I have left a layer of fat. And you can judge the distance or the depth by the feel of the cannula through the skin.
The treatment has provided the desired additional projection whilst preserving the chin's overall shape.
Patients have been very pleased, and their co-workers are wanting to find out when they can have the procedure done. So this is kind of an interesting thing for me, because patients often don't realize what volume in the cheek can do for their face. It's very rejuvenating.
I found the results to be even better than I anticipated. Instantly, the patients are happy looking at themselves right after the procedure in the mirror. They are a little frozen and a little bit of distorted with some swelling, but they can look and see what the final effect is going to be. And some are quite overjoyed with emotion when looking at themselves. I see this product really having a huge demand for patients who have a little bit of mid-cheek descent or needing a little lifting, and even patients who have had facelifts or other cosmetic surgery.
Restylane Sub-Q is a completely new treatment option for instant aesthetic treatment. With Restylane Sub-Q, the facial contours can be defined, volume can be created, and effects filled. QMed's extensive and continuous documentation of its Nasha-based Restylane products vouches for both the safety and the longevity of the implant. Restylane Sub-Q is easy to use, and it provides instant and predictable results with a short patient downtime.